Hey, Margaret, do you see the conference room participant? Can you give that one access to talk?
Yes. Here, I have to stop sharing. All right, everyone. It is 9:05, so we're going to get going. Welcome to our Administrative Fellowship Program webinar. This is the first of three, and we're all excited to be here today to talk to you a little bit more about our fellowship program. So to go over our agenda, we're going to start with an overview of Stanford Children's Health and what we do. We're going to introduce our hosts. We're going to go through a little leadership introduction, then go through the fellowship program overview, the post-fellowship transition, the application process, and then we'll end with a Q&A. So to begin, Stanford Medicine Children's Health with Lucille Packard at the center is the only Bay Area network exclusively dedicated to obstetrics and pediatric care. We have 540,000 pediatric visits annually, 725 Stanford Medicine doctors that are spread across 65 Bay Area locations, and we're currently growing. Further, we're ranked best in Northern California once again, as we are ranked in all 10 specialties. We're ranked number 3 in the Pacific region, top 10 nationwide in 3 specialties, including neonatology, nephrology, pulmonology, and diabetes and endocrinology. And then last, we're best in the West for nephrology. And we provide care in more than 150 medical specialties, and many of which are part of our 7 centers of emphasis, which include the Bass Center for Childhood Cancer and Blood Diabetes, the Betty Irene Moore Children's Heart Center, the Johnson Center for Pregnancy and Newborn Services, the Brain and Behavior Center, the Pulmonary, Asthma, and Sleep Medicine Center, the Children's Orthopedic and Sports Medicine Center, and the Pediatric Transplant Center. And out of all of the statistics you can see here, the ones I want to highlight the most is that our level 1 pediatric trauma center is only 1 of 5 in California. And we are the pediatric teaching hospital of Stanford University School of Medicine. And so now I will go over our introductions. My name is Margaret Ebinger. I am the Junior Administrative Fellow. And we have here today Noriko Nakashi, who is the Senior Administrative Fellow, and Rishi Seth, the Director of the Administrative Fellowship Program and the Vice President of Operations, and you'll meet them both shortly. And while he's not here today, we have our executive sponsor, Rick Majan, who is responsible for providing administrative leadership and direction of operations within Lucille Packard Children's Hospital and all of Stanford Health's primary care and specialty services outpatient locations. And he has 2 decades of leadership experience, and he also served in a fellowship as well. So he's very present in our leadership of the program. And then we also have our enterprise executive team, which as fellows we'll interface with weekly on our weekly meetings. And now I'm going to pass it over to Noriko to go over our Administrative Fellowship Program overview.
Yes, thank you, Margaret. Hi, everyone. So our Administrative Fellowship Program is a 2-year program. There is some flexibility in terms of making sure that you get into your role, so it might differ by a couple months, but that's the gist of it. And we really try to focus the project work in the rotation that you'll be in, and we'll get to those slides shortly and get into what the rotations are. But we do try to have y'all focus on that. And then 25% of the work is typically related to organization-wide projects. We're really committed to providing mentorship for our fellows. So during the rotations, you'll get a set of leaders that you'll be able to interface with and get some mentorship from by getting weekly or biweekly meetings with them. You'll also get exposure to the projects that you'll be working on and meeting the leaders that lead those, but you'll also be able to have the opportunity to shadow meetings, sit in on executive meetings, as well as like department-specific meetings. And just for awareness, we do only select one fellow a year. So we do have the one fellow who is the senior fellow and a junior fellow throughout the year. So a day in the life of an administrative fellow who works here, right? You have the project management component. So we do get put on projects throughout your rotations. But the first big project that you do get put on is recruitment. So I know not all fellowship programs allow fellows to do that, but that's like the first big project as a part of our fellowship program. We also get to be a part of operational meetings. Some of them, again, we may be able to even get to the chance to present at if we do have a project that is affecting operational initiatives. And we also get to sit on executive level meetings, again, as discussed. You will also be able to have a chance to get like one-on-ones. And there's also a lot of task forces that we have to accomplish our goals that are set throughout the year. And then you'll see to the right of your screen is just a day that I had as a fellow. So you'll see that we have the huddle calls in the morning where we get to interface with leaders and people on the team about what's going on at the hospital and our ambulatory sites and making sure that all of our leaders are getting that awareness. Then I have a director's meeting that I get to sit in on and get to shadow by also at the same time. So I'll juggle between each week whether I get to do that director's meeting or get to do my project work. So We Ask Because We Care is a project that I'll get into in the next slide. Have a one-on-one. I have like a foundation meeting that I sometimes get to attend. And then I am luckily participating in a project where we're leading anti-racism training across the hospital. And then you'll see at the end of the day, we had happy hour with our new fellow. So that was a really nice way to end off that day. And so as an example for a project that I've had the opportunity to work on while at my time at Stanford is the We Ask Because We Care initiative. It's related to Stanford medicine as a whole, rolling out this initiative to better understand our patient demographics and help really do the just foundational components of our health equity work. So as a fellow, my role is being the project manager and completing the implementation of REAL, which stands for Race, Ethnicity, and Preferred Written Spoken Language, as well as sexual orientation and gender identity questions for patients. And again, my role has primarily been as a project manager, so I've been able to oversee the project for the children's side. I've also been able to facilitate work group meetings that contain people from various different kinds of departments, including IT and IS. They also include our operational people. And again, I get to provide updates to our executive sponsors, project sponsors, and the steering committee that sits over all entities of Stanford Medicine, which includes the Children's Hospital, Stanford Healthcare, the Adult Hospital, as well as the School of Medicine. So I'm happy to share that, we're fully in our second phase and very much looking forward to the rollout of that.
And now we're going to pass it over to Rishi Seth to talk about the role definition in our fellowship program and some of the structure.
Hi, everybody. Thank you for joining. This is really one of my favorite things I get to do and work with our fellows on a regular basis. So just starting at the top, as Margaret mentioned earlier, Rick is our executive sponsor, and he not only serves as our exec sponsor, but and our program sponsor, but he will actually read every application that we get. He meets monthly, formally meets monthly with the fellows, but he will also text, call, email, in between those meetings to make sure not only to touch base, but also sometimes to assign some work. As the program director, it's my job to make sure that the work you're doing, so for example, the project that Noriko just talked about as our We Ask Because We Care, we really wanted to scope that it wasn't too big for her, and she was learning something from it. Sometimes people can get, if we don't spend enough time really focusing the work for the fellow, we can get a lot of scope creep, and projects can last for a really long time. So we have to be careful of that. I meet with the fellows every other week. I see them virtually every day that I'm here, so that we can catch up, even if it's just for a couple of minutes. Our CHRO, Marcy Atchison, helps us with really on the front end and back end of transitioning in new fellows, and then also finding the right position for our fellows at the end of their fellowship. At the end of the 2 years, she and her team provide a lot of help looking for the right position, and then also providing mentorship in where the fellow wants to go with their career. We'll go into some of the details on our rotation sponsor, and you'll see names there, but what you really want to understand is we've created a triad in each of our rotations. The rotation sponsor is always somebody on our senior leadership team, and then our program support and rotation leadership vary on their levels depending on the rotation you're in, but it's really the program support is focused on what work are they doing, and they meet regularly for that rotation. The rotation leadership should be meeting more frequently with the fellow and spends a little bit more time on vetting some of the projects before the work goes through, and also ensures that any shadowing and for the fellow to learn the area, because when we say an inpatient rotation, that's a very large name. So we want to make sure that they're focused on how do you shadow a case manager, pharmacist, RT, nursing, resident, attending. So that's really what we expect the rotation leadership to do. Margaret, go to the next slide, please. So I'm not going to go through all of the names on here, but I just want to highlight in the middle, in the blue on the bottom left, you see Jesus Cepero. So Jesus is our Senior Vice President over Patient Care Services and our Chief Nursing Officer. He serves as our sponsor for our inpatient rotation. And then you have two leaders between Jesse and Luann who serve as program support and rotation leadership. And we've done this specifically for our program support. Jesse also oversees our quality and our PI teams, along with a host of other areas. And we really want our fellows, when they first get here, to learn about our daily management system, our Packard quality management system, understand how that works with the flow of patients throughout the system. And so she will help set up some of the projects, because there's a lot of learning that can happen in her areas at the beginning. Luann, as our ACNO over women's and infants and of clinical access, she will help with who do you need to know in the inpatient arena? Who do you need to work with and get to know a little bit better? And she really helps set that up. They both meet with our fellows on a regular basis. And then if there's questions or there's issues, they can always come to me as somebody to chat and say, which way do you want a fellow to work on, or what are they doing? And as you can see, we have 3 set rotations, but I think as you saw earlier in the slides, we're a little bit flexible on that. And we expect about 75% of your work to stay in that rotation. And what happens on our regular bi-weekly meetings with me is I always ask, hey, tell me about the projects you're working on, and then anything else that's coming up. because we want to make sure not only is bandwidth preserved, but that the projects aren't just a bunch of grunt work where you're just doing a bunch of analytics and it's not leading anywhere. I will be honest, there are times where there might be, hey, can you help create this presentation in the next week? And we'll explain why it's a good learning experience and who the audience is. And even if one of us is doing the presentation, Rick or myself, we'll have the fellow there to see what the conversation was. All right, next slide. Okay, so as we go through the roadmap, so initially we like our fellows to start sometime in the month of July. We spend a good amount of July and some of August really immersing the fellow into the organization, a lot of one-on-ones with senior leaderships and other executives, shadowing, understanding how everything works, and meeting with some of the meetings you see at the bottom. For the first 6 months, and sometimes that's fungible, but about the first 6 months, we'll be in the inpatient rotation and with the leaders I mentioned before. After that, we have you go to our ambulatory team, and you'll already know these leaders because you've spent the first 6 months meeting with them, you've seen them in meetings, and so they won't be unfamiliar to you. But then you'll move over to that and have ambulatory specific projects. The great thing about having this rotation system that we have set up is, excuse me, there are times where within that rotation, something higher level or something more interesting than just a project shows up in a rotation. Noriko's about to embark on a project where she will serve more in a leadership role and less in a project role for ambulatory. So we really want to make sure that they stay connected to that senior leadership team member at the top. And next slide. So then the second year, we have our team start in strategy. Strategy is a big part of what we do. We are actually embarking on updating our 5 to 10 year strategic plan. And both Noriko and Margaret are going to be involved in that because it's such a good learning. You only get to do these things every once in a while. So it's a really good learning experience. And Rick Itamoto, as our Chief Strategy Officer, serves as the rotation sponsor. And then Tammy Deeb and Charlotte Stallworth serve as leadership in there. Again, they'll be working on service line director meetings, and no one should be unfamiliar with the team because you've been here for a year by then. The last rotation, we leave that up to the fellow. There's lots of things that they may be interested in, and then we'll just work to make sure that the project makes sense. And sometimes it might be transitioning into a role. We had a fellow a few years ago who really liked digital health, and there was a role that she could fill while she finished her fellowship before she went into that permanent role. So we will be flexible on that and ensure that you still have plenty of time to learn and you still have all the access you have when you're a fellow. Next one.
Okay, yeah. So for the fellows, again, like Rishi was talking about, we ideally would like for the fellow to transition into their new role sometime within the second year, right, by a couple months. But again, depending on what's open, what is really piquing the fellow's interest, we really do a good job of like trying to figure that out and making sure that you're getting into a role that makes sense for you. So as you can see, like at the bottom, January, May, there's like discussions with senior leadership, Rishi and Rick to kind of just discuss, right, what are potential possibilities for the fellow to get into. That June-August period, you may begin to do an interim position or role while that role may be being finalized for that team. And then hopefully by August, you've officially transitioned into that role and out of the fellowship program. And, as Rishi was saying, it can differ from person to person, but we've had people in various different roles. So like we have one of our former fellows who will be on the call and will be available for Q&A. She is a business manager for patient care services. We have another fellow who's also on the call who has recently just this week transitions into his new role as a business manager and strategic partnerships. We've also had fellows transition into a program manager role as well. So the deadline is the 29th of September. We do have a NAVCAS account, so we will take in applications that way. However, if you don't want to go through NAVCAS, you are welcome to send in your application to our email. And it's the same, exactly the same information that we're requesting. So again, like the cover letter, your resume, the personal statement document should be all the same. And then we're also going to ask for your transcript as well as the 3 letters of recommendation. And again, like it says below, you're also welcome to do NAVCAS if that's easier for you. And the timeline for us, so again, 29th is when applications are due. We really want to have a quick turnaround. So we'll be doing first round interviews that following Monday and Tuesday. Again, we'll have another quick turnaround and you'll be able to have an interview with Rishi and Rick, the leaders for this fellowship program. Once we've chosen our finalists, we will have an on-site dinner. They'll be able to come out to Palo Alto. They'll get to meet with, again, Rishi, as well as Rick and some other leaders who will be available for that dinner, as well as current and past fellows. And then the following day will be an on-site interview day. It'll be probably from around 8 or 9 to sometime in the afternoon. So it'll be a pretty extensive day of panel interviews. You'll also get an interview with Paul King as well as Rick. So, again, our leadership is very involved and very much looking forward to getting to be a part of the process in terms of picking out the next fellow. And then sometime in mid-October, after we've been able to do our on-site interview day, we'll make the phone call to the candidate for our final selection. Well, thank you. Oh, sorry, you go ahead, Margaret.
So that wraps up our formal presentation. And so now we wanted to open the floor to any questions that you might have. So, and feel free to either raise your hand or type your message in the webinar chat and we'll be happy to answer. Yes, Anna?
Hi, good morning. Thank you so much for hosting this great informational session. Just had a quick question. I think you guys mentioned there were some past fellows there. By any chance, how prepared did you feel by the end of your fellowship program at Stanford to take on your new role?
Margaret, do you want me to take that one?
Yes.
Oh, okay. Hi, this is Jordan Graham. I was the fellow from 2019 to 2021, and I'm just wrapping up my second year in my post-fellowship position. I think that I was really prepared, mostly because my fellowship happened in kind of the beginning stages of COVID. I had been here for about eight months before COVID really started spreading and kind of impacting everything that we do. So I think that just in general, my fellowship experience prepared me for having to be nimble and flexible with changing priorities of a big healthcare system like Stanford. I also think that our fellowship has such a great mentorship and leadership support structure that I felt like I really knew the lay of the land for our organization, and that really helped me transition into my current role, which is the business manager for patient care services. Patient care services is a large chunk of our hospital. I report to our chief nursing officer, Jesus Sapero, and support pretty much all of our inpatient nursing areas, our advanced practice department, patient and family services. And so just being able to have a broad exposure during my fellowship and networking and being mentored by the leaders in all of those areas really prepared me to move into this role. And now 2 years later, after taking on this role, I'm starting to kind of elevate myself in my current role and taking on additional teams in the next few months. So I really feel like the fellowship prepared me to succeed here at Stanford Medicine Children's Health.
Thank you, Jordan. And we got a message in the Q&A chat that says, in the application, is there something that we focus on more than the other, like letters of recommendation, personal statement, or our official transcript? And so I was wondering if Rishi maybe could answer that, or Rico, since you've been through the recruiting process so far.
I don't think there's one thing that we focus on more than the others. I will tell you this, it is for the personal letter of recommendation, please don't have it from a family member. We've had that before where you have, you know, my uncle wrote this letter or something, and that's not what we want to see. We want to see a personal reference. It can be, it can still be from somebody you work with, but maybe from further back and knows you more personally than just professionally. That would be the only thing I would really say. I would say also double check spelling and also check the titles you put out. We recognize that you're using the same personal statement for multiple places, that we wouldn't ask you to rewrite it for everyone, but please don't send us one that says we want to come work at you know, Texas Children's Hospital and send it to us. So we love Texas Children's, but if you're coming to us, we would like to see that on there. That would be the only thing I would really say. We don't value one thing over the other.
Thank you, Rishi. Any other questions? Okay, so in the chat, somebody asked, what values do you see upheld throughout the organization on a day-to-day basis? Also, is relocation assistance available?
You answer.
Yeah, I can answer. So relocation, yes, that is provided to the candidate who, well, you actually have to like be coming in from out of the state, but if you are coming in from out of the state, you do get a relocation component to your first paycheck. And in terms of the values that are held here, I really like working at a pediatric healthcare institution. I feel like a lot of the leaders as well as the teams are very mission driven. And I think you'll see that from like probably any children's hospital, but I really have enjoyed my time here. I think a lot of the leaders are also committed to your learning. They want you to be the best you can be, and you know, they want to see you grow. So I've really had a great experience, like just seeing how much people are passionate and, you know, really wanting to make children's health better, especially with our commitment to health equity. I feel like we've done a lot of things that just show that we're committed to it, that we're going to stay aligned with it through our goals, through the projects that I've been working on, as well as just like hearing the leadership talking about it. So that's like something that's also was very important to me when I was coming in. So just having leadership be supportive of that has been really great to see.
Thank you, Noriko. We have another question from the chat that was, what is the best way to reach out to current and past fellows and to learn more about their individual experiences? And I'll take this one. We have our fellowship email on our website. I think I can pop that into the chat soon. You can also email me directly and I can put that in the chat as well. And then as far as past fellows, a good way to reach out to them would be to add them on LinkedIn, shoot them a quick message, set something up, or just, you know, write them a few questions that you have, because we're all really excited to be here and excited to answer all of your questions and help you get to know a little bit more about us and what we do. And then a following question asks, are international students eligible to apply to the program? If yes, does the program sponsor international candidates and students?
Yes.
Yes, we'd be happy to do that. The one caveat I would give, just because I just learned this last week, is if you need a sponsorship for an H-1B visa, we are very happy to provide it for the fellowship. If you were to leave Stanford Children's at any point, just be aware that your H-1B actually ends at the date of that you leave Stanford Children's. It's something to do with public institutions and the way that the visa system is set up. It's not something we can control. So we're very happy to do that, and it's not a problem. Just wanted to give you a heads up about that last thing.
Thank you, Rishi. And do we have any other questions from the chat? All right, I just put my our fellowship email and my personal email into the chat for you guys. And if we have no other questions, I think we can start wrapping up for the day. But thank you all for being here. We really appreciate it, and we're excited to hear from you later. All right. Bye.